Hi, I'm Bryce Wylde, P3 Health Associate Medical Director and Alternative Healthcare Clinician. You know, the most common question I get from anyone looking to see me is, what can I expect and what do I get? So I thought it'd be helpful to summarize this for you in a video form. I've been in clinical practice for well over a decade now, and I've advised thousands of patients on their path to wellness. And what everyone wants to know is, what is the underlying cause to my health problems and how can I use natural approaches to help? Well, I practice using the latest science and technology, and I've used many laboratory panels to screen patients to help answer exactly this question. A comprehensive battery of screening and laboratory analysis has become part of my toolkit to help decode your health issues. But even before I put you through all that, and before I have the pleasure of meeting you in person myself, you'll be seen by Dr. Cher Beauvais, our lifestyle coach. And she assists in customizing the various programs offered by our wonderful roster of doctors and clinicians to meet the individual health goals of each person. You'll also undergo a customized fitness assessment conducted by our fitness expert and partner in health, Brent Bishop. He and his team at Think Fitness Studios have all of your fitness needs covered. Then, in that same initial visit here, our lab technician and nurse will work with you to use vetted laboratory sciences and technology to investigate your body composition for fat, muscle, and hydration levels, as well as intracellular mass, which is like your cell function. You'll also have the adrenal stress levels measured. And keep in mind that maintaining low stress chemistry is imperative to your health. Urinary chemistry is then closely looked at for pH levels, vitamin C status, and risk of infection, as well as kidney function. I'll also have your complete blood vitamin levels tested and be able to advise exactly what your deficiencies are and customize a supplement plan that fits your individual needs. Now, taking a multivitamin is not the solution, nor does it address your personal requirements. Furthermore, I'll measure your antioxidant levels using a gold standard 8-OHDG test. And knowing this helps you to determine your dietary needs and a protocol that will immediately help you with your health issues. Now, antioxidants are the reasons we're told to eat more blueberries. They help your heart, your brain, and even prevent cancer. And besides antioxidants, I'll also assess free radical levels, which helps me to understand your levels of inflammation and predisposition to certain diseases. A detailed look at your mineral status is also conducted, and this helps to identify all of the important minerals and trace minerals necessary for bone, skin, hair, nails, and immune function. I look at brain and nervous system as well, and the chemistry is called neurotransmitters. These are feel-good, mood-related hormones you may know as serotonin and dopamine. And if they're low or suboptimal, they can often be corrected naturally as well. Our gut, that's in charge of what we absorb and represents 80% of our immune system. Assessing this tells me about any imbalanced or good or bad bacteria, digestive function, and of course the state of your intestinal health. And it doesn't end there. Omega-3, 6, 7, 9, and even omega-12 levels are also evaluated, and this is key to identifying your need for more or less of these essential fats and the enzymes necessary to process them. Lastly, toxic metals. We screen for those too. We're surrounded by heavy metals and other toxins, so knowing if mercury, lead, cadmium, and other heavy metals are too high in your body is imperative to identifying your personal need to detoxify or chelate and remove these disease-causing agents from your system. And if it makes sense too, I may also check your DNA for certain genetic predispositions. You can't change your genes, of course, but you can manage them better and prevent premature disease expression using dietary, lifestyle modifications, and supplementation, of course. And when I finally see you in person, that's your second appointment here at P3 Health, and collect all of your medical history, I will spend an hour and more often to hear the full story of your current state of health, and then put together a comprehensive plan of action that details nutritional, supplemental, lifestyle recommendations, along with a plan for homeopathic, intravenous, or any other necessary therapies and investigations. And I do this in collaboration with other P3 team associates, including Dr. Tim Cook. He's an internist here, and he's a medical director, takes special interest in mindfulness-based stress reduction techniques. And together with all of your personal medical history, lifestyle assessment, fitness assessment, diet assessment, and of course laboratory assessment, we can provide a very customized, detailed health plan and assistance with navigating our health system here, getting tests and other specialists involved by consultation referral. And at your third visit, I see you back to evaluate and record progress and modify any necessary changes to the health plan of action and possibly book you for follow-up with myself and other associates here at the office. All of this is included in my healthcare package. Costs associated with additional testing, not mentioned in this video, or costs of supplements, of course, or costs associated with seeing any other healthcare practitioners here is not included, but structured as very affordable. For more information and detail on our pricing, please visit us at p3health.net. And remember, your health's an investment, not an expense. We look really forward to helping you soon.